Welcome to Week 4's presentation on Alzheimer's and dementia. Alzheimer's disease and dementia affect millions of Americans every year. Alzheimer's is the most common type of dementia, and nearly 5.2 million Americans are currently living with Alzheimer's or dementia. Adults 65 and older run the highest risk, and risk increases every year after. Morbidity and mortality. Alzheimer's disease is the sixth leading cause of death among American adults and the fifth leading cause of death for adults 65 and older. Mortality from Alzheimer's disease can come from results of brain injuries stemming from not recognizing strokes and falling. Diminished motor skills can lead to fatal injuries, difficulty chewing, and an increase in susceptibility to infections. Currently, Florida has the highest number of people dying from Alzheimer's with 4,831 deaths, and Alaska comes in with the lowest with 85 deaths. Women and Alzheimer's. 1 in 6 women over the age of 65 will develop Alzheimer's. Nearly 2/3 of people with Alzheimer's are women. Women in their 60s are twice as likely to develop Alzheimer's as they are breast cancer. So what are the risk factors? The biggest factor is this getting old. Also, hereditary. Those that have parents, brothers, sisters, or a child with Alzheimer's are more likely to develop the disease. The risk increases with more than one family member affected by the illness. Also, genetics can also come into play, just like with any other diseases. So how do we battle the disease when currently no cures are available? Medication is available to help with cognitive and behavioral symptoms, monitor health for the targeted population, obviously the adults 65 and older. Diagnose and investigate is applied to this health problem to ensure diagnoses are accurate. There are a number of mental health issues, and there needs to correct diagnosis of dementia, Alzheimer's disease, and no other mental conditions. Investigation takes place through censuses, medical diagnoses, and comparisons of symptoms of the disease against symptoms of other diseases. So let's address the issue. The Legacy Project is a project created by the University of Alabama to help patients of dementia improve their mood, reduce depression, and engage socially with other people also suffering from dementia. The Legacy Project helps communication through pictures, cues, and mementos from the residents' past life, and often not only focus on the past but the present as well. Restore, Empower, and Mobilize therapy involves various projects and activities that incorporate family members and caregivers as well. Helps the patient maintain a sense of continuity, self-regard, or pride, and belief in his or her own dignity. Community involvement. The Legacy Project also gets the patients involved with their families and caregivers. Caregivers deal with a multitude of stressors, from helping with self-care to helping manage the finances. Awareness. Awareness is a big thing. A lot of these people affected with Alzheimer's and dementias are people's loved ones. Of all people with dementia that are cared for by a family member or caregiver at home experience some form of mistreatment. So what's being done to try and resolve the issue of Alzheimer's and dementia? Annually, the National Institutes of Health spends roughly 2/3 of $1 billion alone on research. Drug therapies often can help slow the cognitive decline that is prevalent in dementia and Alzheimer's. So what kind of policies are being developed? New policies to address the issue of dementia and Alzheimer's include early detections, proper diagnoses, and further research on medications and therapies to assist people suffering from this disease. Facilitators and stakeholders. Potential facilitators and stakeholders within the community of the state of Alabama should be all health facilities, with special emphasis on long-term care settings such as nursing homes and personal caregivers. The majority of people suffering from these diseases are the elderly, and many of the people reside in nursing homes. The quality of care often questioned in many of the facilities due to lack of staffing, because staff is overworked, low workforce retention, lack of technology, and reliance on medical funding. So we need to inform, educate, and empower our society so they have a better understanding of what's going on with our elders. Identify and promote culturally appropriate strategies designed to increase public awareness about dementia. Coordinate national and state efforts to disseminate evidence-based messages about risk reduction for preserving cognitive health. Develop strategies to promote the availability of services for people with younger onset dementia, including Alzheimer's disease. Promote awareness of abuse and exploitation, and support related prevention efforts as they relate to persons with dementia, including Alzheimer's disease. Get involved. Get out there, get in the community, and know what's going on. By working together, individual states and the federal government can create financial incentives to integrate healthcare and long-term care for people with dementia. Owners and administrators of nursing facilities to educate their staff in how to identify the needs of Alzheimer's patients. Elder abuse is becoming more and more common, and Alzheimer's and dementia patients do not always have the means to communicate misconduct. All facilities should provide clear job description, job responsibilities, expectations, and hold staff accountable for their performances. This has been a presentation on Alzheimer's and dementia. This is Team E. Thank you for your time.